Hello students, this is Dr. Johnson and welcome to Nursing Leadership and Management. Unfortunately, I had to record this since we had a visitor last week, so we didn't finish the class. For this class, we're going to discuss the responsibility of being a leader, some of the differences between leadership and management theory, and how do we differentiate the 5 functions of the management essential activities, how do we integrate patient-centered care in our practice, and how do we build an effective team. And using the nursing process, how do we do problem solving and planning, and how do we apply the principles and strategies of change theory in management role. So as a professional nurse, you will be put in position to be a leader. It may not be one of the roles, your assigned roles, but in all your practice, you will be called upon, even if it's at the bedside, to be a leader in assessment, in coordinating PI management issues and all that. So it helps you to grow your leadership and your management skill with this lecture. So it's a very important lecture. So some of the key terms that I want to talk about that you might also see throughout the lecture is authority. What is that? How do we define it? It's actually a term to define what is given to another person in terms of leading or in terms of being in charge of a project or a team. Healthcare organization for this lecture would be everything that we might see nurses work, take on roles as nurses, from the hospital to this community to corporate. So there are different places that nurses can work, and sometimes we're just hired because of our leadership skills. Leadership is how do we influence people so that we can have an outcome that is the outcome that is given to us to achieve. So for instance, in hospital, the outcome may be to pass joint commission. So how do we influence people so that they can continue to provide quality care so that we can achieve a good outcome? And management is how do we manage resources to get to that outcome without overspending, without being extravagant, and of course being mindful of all the parts of the team. Organizational chart is where the lines of communication and authority end. So for instance, if you have a chief nurse officer, where is she in the organization? Is she in the C-suite? Is she with the chief medical officer, or is she below that? Who does she report to? And then you have productivity, the amount of work or the outcome that we're looking to achieve or to produce. And then your resources, what do we need to make those outcomes, to achieve our goals and productivity. So those are the things that you keep in the back of your mind throughout the lecture as we go through it. So who are the leaders? The leaders are the people that it could be they may have authority or they may not, but they're leaders that influence the opinions and the behavior of people. They guide people to achieve good outcome or to achieve a common goal. And as I mentioned, they don't have to have a title to be a leader. So if you think about what's going on in the community now, there are some community members that will mobilize the community to do something, and they're not necessarily, they're not senators or governors or mayors, they're just part of the community, but because they're respected in the community, they influence other people to make decisions, to make a change. The same with managers. Managers do not have to be leaders. Managers is a role that is given authority and a role that is given to somebody to be in a position to help to coordinate the resources to achieve the common goal of that institution or the person that gave them the authority. So some people can be both. They can be managers and leaders, and some people can just be managers but not leaders. So for instance, if you look in our society today, there are people that their job is to just get things done. They don't care how it's done. They don't care who they step on. They don't care how they did it, as long as at the end of the day, they have what they need and what they want the people they lead to do. So these are managers. So there's a distinctive difference between both. So the leadership can be formal, like we mentioned. It could be somebody gave somebody an authority and then they use that authority to lead. Or it can be informal, meaning nobody gave them authority, but they can be a leader. They can influence people. So when you start working, know who your formal leaders are, but the most important thing is to know who your informal leaders, because those are the people that can make or break you. Those are the people that will say, you know, we have a new nurse, let's help her to get acquainted. Or they can be like, we don't like this new nurse, let's make her life miserable. So just when you start working, keep that in the mind, that you have this type of leadership. And management, we already mentioned, they're not leaders, or they could be leaders, but their role is to coordinate the time and the people and the cost and the supplies and the things that they have to make sure that things are done day to day, right? So they're the managers that they want to make sure that their people come to work, and when they come to work, they have the PPE, they have the equipment they need, so that we can provide quality care for patients. They don't care if they influence people or not, because they can use punishment to influence people. So you don't do what they say, they will fire you. Okay, so the power and authority, you know, authority, again, we talked about this in the first slide. That is to authority is the power that is given to somebody, right? Somebody gave somebody that right to help to direct people, and then they're going to use that right, which is down power, to motivate people to do things. So a manager is given the authority to manage people, right? How she does it is power. What type of, what are the different ways she can get people to do things? So you have reward power, cohesive power, legitimate power, referent power, expert power, informational power, and connection power. So with the reward power, it comes from the ability to reward others. So if you come to work, I will pay you, I won't fire you, right? Cohesive power is the opposite of that reward power, meaning you don't come to work, I will fire you, right? So reward, I will give you good things for coming to work and being a good staff. But if you don't come to work, I'm going to punish you by taking away your salary and giving you warnings, and if possible, fire you. Legitimate power is the power that is given to by the organization to the manager, and the manager will now use that and say, hey, I'm the manager of this floor and I want you to do so and so. So they're using that power that is given to them by the organization to get things done. The referent power comes from the team members identifying with the manager as a leader. So if it's a manager that is also a leader, remember there's two different things, meaning somebody that influences people, that is well liked, or even if it's not well liked, but they are in tune with what's happening to people, they can now, the manager will use that as the power to get them to do things. And you have the expert power. This is where nursing comes in, where we use our expertise as nurses because of our knowledge and the things we know how to do, like assessments and nursing process and all that. And people will look us up to ask us questions based on our knowledge. And then that also can also be information power. Information power is where people have something over you and they're using that to make you do things. So for instance, if I'm a bad manager and I know that my staff is struggling to make ends meet, I'm going to use that information to force that staff to come to work, because I know that they can say no, or they can't say no because they need the money. And then you have the connection power. This is what I've been asking this class to do. Connection power is very important in nursing, because in connection power, it's who you know, right? Or who you are affiliated with. So if I know that I know the president of this school, and I want a job as I don't know, deputy director of the library. I can say, well, I know the president, so let me go ask him because he has the power to give me that job. So it's about connection, about who you know. That's very important. Okay, so there are different theories that guide leadership. So, for instance, a lot has been written in literature about who is really a leader. So, the assumption is that leaders are born with some leadership characteristics, but I actually don't believe so. I think that a leader can develop and can grow over time. But some of the traits that they attribute to leaders are intelligence and alertness and the drive, the passion, the self-confidence. So if you think about some of the leaders you know of the world, does that really tell you if some of them may have some, but not all? So there are some leaders that are self-confident and they have the passion, but they may not have the intelligence or the alertness. So, but those are the traits that, quote unquote, can be the traits of being a leader. But then there are different types of leadership, like transformational leadership. The transformational leadership is a leader that wants to achieve the outcome, but that's not important. Most important is their team. How can they mentor their team? How can they make sure that their team have satisfaction, and how can they influence their team and challenge them to accomplish the goals, and also to make sure that their team are engaged, team members are engaged and communicating with them. These type of leaders are very well liked and admired. Even after they've gone, left and gone, people still think of them as good leaders because of the impact that they have on the people that they lead. And then you have transactional leaders. Transactional leaders are not transformational leaders. They are more on, they put out fires. They're there to see, they work day to day as if every day is a day to put out fires. They really don't care as much about their team members as opposed to their transformational leaders. They are use kind of like punishment or coercive type of power. You don't do what I said, I will fire you. So they are more of like managers as opposed to leaders. So those are the transactional leaders. And then there are three major areas that requires effective leadership. So for a leader to be effective, our textbook talk about technical skills, the human skills, and the conceptual skills. So technical skills for nursing are some of the things that you develop as you continue in nursing, like your expertise or your specialty in where you work, right? So you're developing technical skills on what to do. So for instance, I'm an L&D nurse and I identify as an L&D nurse. So I'm taking it upon myself to make sure that I maintain my technical skills by knowing how to do fetal monitoring, how to do deliveries, how to set the table in the OR, how to circulate, how to monitor the babies. Those are technical skills. I'm using my nursing knowledge and my clinical expertise to develop that. And then you have the human skill. The human skill is very important in nursing. I always say to you guys and also my other students that you can have the intelligence and the passion, but when you don't have human skills, it's nothing. What do I mean by that? The ability to have emotional intelligence, to be able to respect other people, to be able to work with other people. Even when you're frustrated, even when there's chaos, you continue to maintain calm and professionalism, and treat everybody the way you want them to treat you, right? That is human skill. And then you have conceptual skills, the ability to understand the organization as a whole. So you're not, let's say you're a nurse manager, it's not just about your unit. How are the other units affecting your unit? How is the hospital affecting what happens in your unit? How do you fit in? your management type or your management skill, how does it fit in with the overall organization, right? So you're not isolating just your area, you're taking into consideration other things that are affecting it. So to be an effective management using human and conceptual practices, this slide kind of talk about different ways that you can make that happen, right? Making sure that you're up to date with your clinical skills, making having integrity, being able to communicate, having emotional intelligence, being able to commit to the mission and the vision of the institution where you work, and understand some of the things that can happen that you may need outside resources as opposed to just inside resources. So let's talk about some of the management theory is out there. One is management theory itself, that you have different types of leaders. Again, it could be situational, meaning some people will have all these depending on the situation. So like an authoritarian leader is leader that want to make decisions on their own. They don't need staff. They do it all. They're the smartest in the world. Everybody listens to them, and any input is not acceptable. Those are authoritarian. And if you think about world leaders, look at world leaders and who they are and what type of authority, if they are authoritarian. And then you have the democratic, where you encourage your team members to have input, you ask them for ideas, you help them problem solve, or they, and as their inputs as you problem solve and make decisions. With laissez-faire, it provides little direction or guidance, especially in decision making. So nowadays we want a democratic management, especially in clinical setting. However, many leaders can tell you that their practice varies depending on what's happening. So for instance, if I have a code, I am going to turn into an authoritarian leader because I will tell people what to do. This is not a time to ask them if they want to do things, right? I will tell them, go make the crash cards, that IV, I will give direct, and I don't want any input until we resuscitate the patient. Now, after the patient, I can now become a democrat. After we resuscitated the patient, I can now become a democratic leader where I'm asking questions like, okay, so what do you guys think we did right? Or what do you guys think we did wrong? How can we change this next time? And letting everybody speak up, right? So the idea should come from the team after the code. Now, with the laissez-faire is kind of, I will use this when it's not urgent or the people in the room kind of got it. I'm just there as a figurehead to make sure that things are going. So let's say they're planning a birthday party for the chief nurse. It's not anybody can, it's not life and death situation, but I can be there to help them to, using my referent power kind of to get people to take it seriously or to participate. I will give little or no direction. I will maybe ask them, what do you guys need me to do kind of thing. I won't make decision. I'll leave the decision making for them because again, it's not urgent, right? It's not something that will kill our patients. So you see how you can use all three depending on the situation. So it's kind of like situational leadership. Okay, so some of the framework to understand, especially in complex organizations like hospitals, is like system theory. The system theory is kind of, it looks at the organization as open in the sense that you need outside people or outside system to help to interact with the organization. So it's not closed where only within the organization, there's no input from outsiders. And I'll give you guys an example. So let's say we're having problem with pain management, and you can actually get speakers or people from outside to kind of give you input. Or what happened to us last week, career, getting the career Miss Burnett to come in from the career office to help to do resumes and stuff like that, we are practicing system theory, open system theory, because we're not saying it's just in this class, only Dr. Johnson knows. No, we're bringing outside sources to help, because she's an expert and she will tell you guys better and newer information than me, that is not that an expert with career services. And then you have the chaos theory. With the chaos theory, it attempts to, it's not actually like the name says chaotic kind of, but with the chaos theory, it realizes that things are not the same every day, that things varies, it's unpredictable, right? There's so many things happening in just in a small unit. Can you imagine the whole hospital? So the nurse manager is constantly anticipating that things will happen. So as a nurse manager, they are looking at staffing all the time. They're looking at, okay, somebody may get pregnant or may not have the babysitter coming or may be late because there's traffic. So I have to always have plans in place to make sure that my unit is always covered, even if we have this type of problem. So it's realizing that life is chaotic, but that it's manageable. Okay, so with this question, the answer is actually closed system, because if you look at it, the administrator is refusing to have an outside consultant in, so it's closed. It's open, the administrator should have said, yes, let's get somebody that knows more than us to help us, right? So that's the difference between open and closed system. So let's look at the 5 management functions, and they're usually interrelated. Planning, organizing, staffing, directing, and controlling. There are different phases. Sometimes they occur simultaneously, sometimes they occur individually, but it's never linear. So it's kind of like our nursing process, right? So in the planning, the manager is deciding way in advance what to do, right? So they're looking at long range and short range planning, and they're looking at their goals, and they're actually looking at how would that the day-to-day affect some of the goals that they set. So they may say within a year we don't want any fall on our unit, but within 2 weeks we want to start making sure that we're training our staff on fall precaution. So looking at breaking down the activities to make sure that the outcome, that she's meeting the outcome of the institution of her unit. So with organizing is actually looking at a way to communicate, to make decisions. It helps to define responsibilities of the staff, of the team, and coordinate activities with other departments. So it's also taking into consideration that open system, and also to make sure that the workflow is fluent, like there's nothing to stop the workflow. So this is where you're looking at different protocols and policies and job descriptions to make sure that the work is well divided and that everything is done, so that nobody can say, well, I didn't know that I'm supposed to do it. Everything is planned and organized so that activities will achieve that outcome. And then staffing. So again, we talked a little bit about this when we did delegation, but being able to look at how much, determine, knowing the patient's acuity, the staff that will be needed, and what mix of staff, RNs, LPNs, nurses aid, how do we recruit them, right? Nurses are very instrumental in interviewing and recruiting and training of new staff, and making sure that it doesn't end there. So training is ongoing, and looking at different ways of scheduling so that every need of the unit is met. So you have some units where they have 8-hour shifts, and you have some units where they have 12-hour shifts, and you have some units where they have 16-hour shifts, or they will have people that work only on weekends, and then people that work only on weekdays. So the manager is constantly looking at ways of staffing, again, to come to a good conclusion for her outcome. So there are things that affect nursing satisfaction. The transformational leader is very instrumental in ensuring sources of making sure that their patient has the staff is satisfied. So they have meaningful communication, they empower the staff, they guide them, they mentor them, they actually praise them when need be. They don't throw them under the bus. They do little things like remember that their birthdays or their children's birthdays and stuff like that. All that to ensure that the staff remain satisfied, because a satisfied staff will now give you a satisfied patient. Some leaders, transactional leaders, may not be all that keen into providing satisfaction for the staff. So they may not be supportive, they may not look at bullying, they may not give too much help when it comes to clinical help. They may not be there for crises like, codes and stuff. They may not thank their staff, or they will take credit for their staff work. So again, staff over the years, being in different leadership roles, I've learned that to be able to get anything done, your biggest asset is the people you work with. Treat them right, and then they will treat your people, your patients right, and of course your consumers. Okay, with directing, is actually creating that team, that good team, right? And how do you do this? Communication is so important. Positive reinforcement, making sure that things are, if you're going to delegate, delegate it without any gray areas, and also help the team when need be. So part of the manager is a manager that is using their expertise not only to lead, but also to lead clinically. So if the staff is having problem with unit clerk or unit aide, the manager can put on her scrubs and help them with answering the phone for call lights, answering the phone, giving out the ice, making the bed. Then the team will see, hey, if she can do it and she's a manager and she has things to do, we can also do it. And the manager can also be there to manage some of the conflicts that you see with staffing, especially with new nurses or new staff going through periods of bullying in the hands of their colleagues. The manager can step in to direct that, to stop it, and to find the root cause or who started it. And sometimes it usually starts because they want to see the staff do this because they want to see if the new person can fit in into their unit culture. But it's not right. So we're controlling it to ensure that the outcome that has been delegated to the unit is being achieved, right? And to develop ways to improve it. So this is where performance improvements come in, and the manager helps the team to accomplish the goal. So if the goal is to make sure nobody fell or there's no that medication is managed, the manager helps to measure some of the skills and the skills and the knowledge that the staff has, so that they're now comparing it to the outcome, if they're meeting the outcome of what they said they would do. So part of controlling is also helping with coaching, and you can actually do this in every, doesn't have to always be controlling. But the main thing is to make sure that the person you're coaching needs the coaching and is willing to accept the coaching, but sometimes they have no choice. So giving them perspective, especially let's say there's an error that happened, give them perspective of what you have, and then let them tell you what really happened, right? There's always three sides to every story. And then encourage them to ask questions, be specific. Usually this should be done behind closed doors. Be sincere, and the manager must be realistic, and also thank the employee for having an open mind for the coaching. And also, one of the things, what makes a good manager is, are they willing to accept criticism also from their team, not just one way, that is also back and forth. So which of the following have the greatest influence in the success of a healthcare organization? So it's actually, if you look at every single organization, not just healthcare, if you look at United States Constitution, if you look at your schools regulation, like your syllabus and all that, your student handbook, everything is clearly delineated, and whatever is not delineated clearly is always reversed. That's why every year you're getting new one, or they will tell you has changed with student handbook. So setting clear goals and objectives, very important, because that helps the team to know exactly what is needed from them, and that helps to make organizations that are high productive and very cost effective the best. Okay, so with patient satisfaction, very important now, especially with Joint Commission, and also with HCAHPS. I don't know if you guys hear about HCAHPS in your practice setting, but it's asking patients and sometimes employees to grade the hospital, especially the way communication happens, pain management happens, the cleanliness of the hospital, how the patient is discharged. And from this, they will create a report card and post it online. And actually with this, you also can determine how much money that institution will receive from the stakeholders like Medicaid and Medicare and all that. So it's very important that patient satisfaction and staff satisfaction are continuously assessed, because with that, the manager, especially a transformational manager, will now know how to change or able to guide the team to be the best team. So to build a team, you need people, right? So it's bringing a bunch of people. Some of them very knowledgeable, some of them are not so knowledgeable, but they have other skills. So it's able to bring all the team members, no matter if their education or their background and all that, to accomplish a task and to solve problems. So if on unit you see PI groups or groups that are together to Nurses Week group, or fall group, or risk management group. And this group, they're all coming together from different works, from doctors, nurses, housekeepers, unit clerk, LPNs, to work together on a project or to solve a problem. So let's say your Nurses Week group, it's a bunch of people, nurses from other areas of the hospital with the administrators, planning how to achieve the best Nurses Week for their team, for the hospital. So they usually have a group of people working together for the common goal. So the manager is also a resource manager. And what does that mean? Resource manager is looking at the things that will help the team to work towards that goal. So they're looking at budgets, they're looking at resources like equipment, they're looking at time, they're looking at the human resources, meaning people. So they're looking at things to make sure that they have what it takes to accomplish a goal. So example is during the blizzard that we had, I think 2 or 3 years ago, the winter blizzard, managers were called together to come up with a plan to make sure that the hospital is well staffed, even though people can walk, come outside because of snow. Even with COVID, the same thing. When as your staff is getting sick, do you have plan? Who's going to cover your unit? What if you get sick? Who's going to cover you when you're out? So those are the things that the resource manager is constantly working on. She's also, or he's also a decision maker, problem solver, and they use the nursing process to guide them with decision making and problem solving. And if you think about it, it's one of those things that we have in nursing, that we have a tool that we use to critically manage or to make decisions or to make plans. So if you're using the nursing process, you're looking at some of the, you're using the assessment, you're looking at the assessment to see if there's any problem, and then you're analyzing it to gather more information and to decide what the problem is. And then at the planning stage, you identify many options that could be used to solve that problem, right? And to, you know, to remember the people that will the decisions will affect. We also take into account the costs, the legal, the ethical, the practice issues that will probably be affected during the planning stage. And then with the implementation, it's importance of using effective communication and delegation as you're supervising your staff to do what they're supposed to do. So if you decide, let's say we have problem in pain management, and you decide it's a problem, so you're going to find different cost-effective ways to handle it. So let's say using nurses aides to make rounds as opposed to an RN. So the RN is still going to do the assessment and the management, but the nurses aide can make round every hour to see if anybody is crying or if anybody is in pain, and then they can now get the nurse. And then with the evaluation, you're looking to see all the things you put in place, did it work? And how will you measure it? And when you're measuring it, um, who's going to measure it? Who's responsible for it? And if it's not effective, how can you make it effective? Because you need to now go through the process again and evaluate again. So our nursing process is very important for the nurse leader as she makes decisions and problem solve. So another thing is that the nurse leader is also an agent. The change agent helps to guide people. So during that planning phase, when you're looking at some of the ideas and some of the plans and some of the things to change the problem, it will lead you to implementation. So this is where many nurse leaders get stuck, because with changes come with a lot of pushback. The staff may not want to change. They may like, okay, we've been doing this. We don't need change how we're doing things. It has always worked. Who are you to now come in and start making us change? So the nurse leader has a lot of when it comes to changing, they have to be an expert in how to manipulate it. So it starts, we have a theorist, his name is Lowen, and he developed the 3 classic stages of change. The first one is unfreezing, where the problem has been identified, or that the leader is aware that there's a need for change, right? So they will start gathering information, they will start assessing the problem and making other people aware that there's a problem, right? And then in the moving stage, they've identified that need, so they've had data to prove that the need is warranted. So they will set goals and objectives. They will try to include as many people in the plan, especially that informal leader, because she can get people do things, be available to help and support the team as they go through that moving stage, and make changes and modifications as the changes go on. And then in the refreezing stage, the leader will now use that change and make it permanent, right? It's if it's not complete, if people go back to the way they usually do things, right? So their job, or his job, is to make sure that they are now doing the new process. They will find ways to get staff to change. This happened to us when we first went on electronic documentation. It was horrible for the nurses that were senior nurses, because all their life they've used pen and paper. Now you're telling them they have to type everything, and so many of them resigned. So the people left were encouraged and supported. And I remember managers not leaving. They would stay with the night shift, off shift, helping, guiding people how to use the mouse, where to go, how to document, how to cancel, and all that, and how to do. So it's a lot of work that goes into change, but it's worth it at the end. Okay, so we already talked about some of these changes and stages of change. So the main thing is to know the different stages, what goes into what. Again, if you look at it, it's almost like our nursing process again, right? The implementation stage of the nursing process. Okay, so other roles that you might see the nurse leader do is clinical consultant. They are hopefully experts, and they're usually looked at to give their expertise. They can be staff developers. Again, this is making sure that each member of the team, no matter what their degree or no matter what their expertise is, that they also constantly help to grow career-wise, and of course personally too. So teaching them, bringing research, bringing evidence-based practices and sharing it with the team. They also can be mentor. A good manager, leader, or leader manager mentors new nurses. They will give them ideas how to succeed. They will give them ideas how to manage some of the things that they may see as new nurses. So just like in your school, your professors are all your mentors. Your professors are telling you, some of us that are still working out in the field, we're telling you guys what's there, how to get there, how to succeed when you're finally there. So that's part of leadership. And of course, a leader is also a corporate supporter, even though they have to do get their team, their unit running and their team running. They also have to be cognizant of the mission and the goals of whoever gave them that authority. So usually in the hospital, it's knowing what is the hospital, what do they want, right? Whenever somebody hire me, I always ask them, what do you want from me the first 6 months? What do you need from me? Because by then I know why they're hiring me, and I can work towards that 6 months. So a good leader is somebody that is working with her team, but also working with the management team. Okay, so part of that is creating a respectful environment. Uh, Good leaders should be sincere. They should be good communicators. They should learn to be grateful. I always say that a good leader leads from bottom, meaning the people that they're leading are the assets. Without your team, there's no leadership, right? So they should learn to appreciate their team, thank their team members, provide them with guidance, kind of don't throw them under the bus type of thing. So if anything goes wrong, a good leader will say it's our problem, not just your problem. It's our problem. And if anything goes right, it's our right? Meaning it's everybody's celebration, not just mine, not just yours, it's all the team members. So some of the caring actions, very easy, giving sincere recognition, giving praise for a job well done, providing guidance, having confident attitude, meeting staff personal needs. So a good transformational leader, somebody come and say, oh my God, I'm so sorry, I came in late. I don't ask them, this is the second time you're coming late. If you do this again, I'll fire you. No, I'll be like, are you okay? Yes. Is there anything I can do for you? No. Okay, please try to be on time next time. We really need you here. Yeah, if you don't come on time, so and so can go home. And you're part of my team, and I want us to all look good. So that makes a difference than saying, don't come to work out late again, or I'm going to fire you, stuff like that. So the difference between transactional and transformational, that the transformational leader is always there for their team, is humane for the team. It's not just a boss that tells you what to do. So also a good leader should look into making sure that the team is not bullied. And what is bullying? You would think bullying is somebody's always picking on you kind of thing. Yes, that is, but in practice, it can be gossip. It could be being verbally abusive. It could be disrespectful, profane language. It could be things that many nurses will tell you has caused them to leave the industry. So I remember years ago, doctors can actually call you out in front of everybody and put you down and humiliate you and call you names and all that. That stopped when many nurses started complaining, and actually started reporting some of these doctors. I actually knew a doctor that they had to kick out because he was just downright rude to a nurse. So it's not being tolerated anymore, and it should not, because hello, it's too much out there to be dealing with nonsense from your fellow nurses. So I know in the olden days, they used to say it's roasting the nurse, that every nurse goes through it, but that's not acceptable. The leader should be able to shut it down. They should, because many staff will, I've known staff that actually kill themselves from bullying. So it should be one of those things that is not tolerated, because it's now affecting work. So how can a leader do it? They should recognize that it's happening. They shouldn't be ostriches. Ostriches are people that say, oh, it's happening in my unit. Never. So they should recognize that it's happening. They should realize that the person that is being victimized is really not the problem. It's usually when people victimize you, it's because, or bully you, it's because there's something they're lacking. So, and they hate that they're lacking that, so they take it out on somebody else. So the leader should recognize this. They should encourage the victim to keep track of all the bullying, the incident, who did it, the time, because it can actually go all the way to HR, where it's the person that is bullying can actually be terminated and can be sued. So again, this should be part of training for all staff members, that is not tolerated, and that if it's ever reported and proven and documented, that the person will face the consequences. So when staff see that the leader doesn't support this, they're going to not do it, and the leader will have longer staff that will be there longer than maybe 6 months, right? So they will maintain and recruit and retain their staff. So I think I already talked about this, about making sure it's part of the policies, making sure that it's being reported, and that the person can actually be encouraged to go all the way to HR. So all staff should know that this is happening in where they work. And if it's not, it's time to implement it. Okay, thank you. And that brings me back down to, I think with this lecture, you guys have caught up. So we will continue next week. And if you have any questions, please feel free to reach out to me. Thank you.